Today I'm going to show you a quick ankle mobility self-assessment and a corrective exercise you can use to start to get more mobility in your ankle. Hi, my name is Dr. LeBauer from LeBauer Physical Therapy in Greensboro, North Carolina. We help active people and athletes stay fit, healthy, and strong and look younger than your age. So, recently I had an opportunity to work with a few different athletes and even some dancers. And while some of these dancers are super mobile, I noticed that their ankles weren't moving as well as they should, or as well as the rest of their body. And I've worked with football players, soccer players, cyclists, basketball players, and a lot of times our ankles don't move nearly as well as we expect them to. You need good ankle mobility to get into a squat. You need good ankle mobility to walk down the steps. If you're lacking ankle mobility, you're going to get it somewhere else. Maybe your toes, maybe the middle of your foot. Sometimes I've seen it in the knee. I had a patient come in and she was in an ankle boot because she broke or sprained her ankle or foot. She was in there for like 4 or 5 months, which is way too long. Someone didn't give her the right instructions, and she was getting what's called recurvatum in her knee. Her knee was moving in a way it's not supposed to, so that she can travel over her foot. So this is the ankle joint. A lot of people will say, hey, I've got flat feet. Flat feet aren't bad feet. Flat feet are feet that have a lower arch. Sometimes you can have a bone or joint that is kind of more collapsed. But most people with flat feet just have lower arches. That doesn't mean that their feet aren't strong. So if you've been told you have flat feet, that's not necessarily the reason why you have pain or have an injury. So I'm going to show you a quick assessment for ankle mobility. If you're having trouble in a squat, or you're having trouble jumping, running, pain with lunging, etc., foot pain, even balance problems, it can be caused by by the motion in your ankle joint. It can also be caused by your toes, your knees, your hips, your core stability. It can be caused by the other side of the body. So real quick, if I take my foot like this and I bend my knee forward, you can see my knee comes forward. So one of the tests is to take your fist, put it in front of your toe. You can line up against the wall here, and I should be able to hit the wall with my knee. You can take a stick, same kind of thing, a broom, a cross stick, something like that, and I want to move my knee forward. My knee should be able to touch it without me moving the stick closer. So watch when I change feet. There's a difference here. I can lift up my heel. But I don't have as much ankle motion on this side. I'm working on it, but it's not as much as the right. A lot of times people will have good motion and your knee will hit. So here's the test to see if it is a midfoot or ankle issue. Take a shoe. I've got like a 1/2-inch piece of wood here because I'm in my garage. You can take a little 10-pound plate, and you're going to put just the ball of your big toe on there. And then I'm going to line up my distance, and you can see I don't have nearly as much motion. Let's test the other side. Just the ball of my big toe. I don't have nearly as much motion. Either side. Okay, now this isn't necessarily my issue. I've been working on this. A lot of people will have this as an issue, and we want to mobilize the subtalar joint, the joint under the talus, which is just a bone. We want to mobilize your ankle and not necessarily your foot. So if I'm just stretching here, I can be getting a lot of motion in my foot. Foot can collapse. Just lifting this up keeps the first metatarsal bone of your foot from moving. And it moves all the motion back here. So, okay, great. Now we know we got an ankle that doesn't move as far as it should. If you don't get here and I don't win, this isn't about winning, but you can still run, squat, jump, walk, play. This is not a problem. It's not a contest. A lot of athletes and people who compete, they're like, oh, it's a contest, I have to win, I have to do what he says. If the left and right aren't very different, this isn't something you need to work on. And one other disclaimer is this may help, this may not help, it may do nothing. In all three cases, if you're having pain with movement, pain with from an injury, pain with a sport, if this helps, great. There's something in physical therapy that can help you. If it makes it worse, well, we're looking in the wrong place or the wrong dosage. If it does nothing and you're still having a problem, you need to get a total body diagnostic. In all three cases, you need a total body diagnostic from a specialist doctor of physical therapy who understands your sport, your movement, your goals, your dreams, your desires, and the injuries that you've had. And who's willing to sit and speak with you for at least 10-15 minutes, if not an hour, to talk to you about what's most important to you, to take a full look at your body and uncover the root cause of the problem and help you build a plan to fix it once and for all. If that's you and you live anywhere in North Carolina or you'd like to work with us, just message me the word call over on Instagram at LeBauer PT, and we'll set up a free 15-minute call for you to speak to one of our doctors of physical therapy. Now, this is going on YouTube, so commenting below isn't really going to notify me or do much. You need to find us at LeBauerPT.com or Instagram. The links to those are going to be in the bio below, or in the, not the bio, the description below. So let's say one ankle doesn't move as well as the other, or it hurts or pinches, especially if it pinches. There's two things that you can do, two variations of the same thing. One is we're just going to come into the end range of motion, and what I'm looking for is knee closer to pinky rather than knee in this direction, knee closer to pinky. And I'm going to come to the end range, and I'm just going to stretch the joint. And I'm not going to bounce, I'm not bouncing. I'm just going to kind of stretch into the joint and ease up a little bit and just pulse 2 or 3 times. Get a nice little stretch there. You may feel stretch in the muscle, you may feel stretch in the ankle. Depends on what's limiting you. Now, if you're someone whose foot kind of flattens out as you go forward, take the top part of a shoe, rolled up towel, a piece of wood, a thin piece of wood, not a 2x4, a little change plate or something to block your big toe, this big toe joint, from moving, and then you can work on it there. And we're going to kind of mobilize into that. A variation of this is using some kind of band. Now this is a little more complicated, so what we're going to do is we're going to take any kind of elastic band, not really an elastic, not really a belt or a yoga strap that's not elastic. I've got this like elastic band hooked up here. I am going to put a loop or part of the band around my ankle, and I want it below the ankle bones. Sometimes you might want to take a dumbbell or a kettlebell and lay it over the back because that takes the angle down. And move to where, make sure you can see this. Okay, right here is just fine for me. It's below the ankle bones. I can kind of lay a weight there to get it. And then I'm going to do the same mobilization, but the band is now pulling backwards. Based on the way the band's pulling, I'm going to angle my body this way, and I'm going to get that same kind of stretch here. 3 or 4 different, like, just gentle pulses at end range. Come back up, and we can test. Test again. Like this side wasn't the problem side. Don't let your heel come up. And this may help. This may not. Again, if this is the right thing, great. Please let me know below. As soon as you get more range of motion in your ankle, there's 2 things I want you to do. I want you to load the joint. And in one of our other videos, I'm going to show a single leg deadlift and how to load your lower body, which is great for your ankle, foot, hip, core stability. And you can also go back and do some squats or goblet squats. I've got a video on goblet squats as well. So loading both joints or one joint, depending on what you need. Remember, this is YouTube. You can throw spaghetti at the wall and see which piece sticks. However, if you have a specific problem that you'd like some specific help with, make sure you reach out to a physical therapist or physiotherapist in your town or city Yeah, like I said, if you're in Greensboro, you can contact us below, or you're somewhere in North Carolina, we'd love to work with you. Even if you want to travel in here, I've had plenty of patients do that. Come visit family in Raleigh, drive an hour to come see us for a couple days of treatment, and go back. Totally cool, people do it all the time. Just hit one of the links below to get in touch with us. Also check out our other YouTube videos. Be sure you hit the notification bell, hit the like button, hit subscribe, and leave a comment below if this is helpful or any of our other videos have been helpful, or with any questions you have. Thank you again. This is Dr. Aaron LeBauer from LeBauer Physical Therapy in Greensboro. This is a ankle mobilization as well as an ankle dorsiflexion self-assessment. If you're one side's not as good as the other, you're gonna have trouble with squatting, lunging, jumping, running, deadlifts, etc. Maybe you don't have problems because you're taking it up somewhere else and your body's really good at that, but we need to make sure that one side's not so different than the other, and we make sure that it's not something that's causing you pain. If you have one side that doesn't move well and you have pain here, that's probably an indicator. That happened to me with my knee. And I had a patient the other day whose right hip hurt, but it was because it was times when they're standing and jumping off of their left leg. They had an ankle mobility issue, and they had a hip stability issue. So check out our other videos, and we'll see you on the next one. Thank you.